welcome you to this very special event as we celebrate the extraordinary service of AmeriCorps members and AmeriCorps senior volunteers who are responding to COVID-19. My name is Mal Coles, and I'm honored to serve as the acting CEO of AmeriCorps, the Federal Agency for National Service and Volunteering. Over the next 30 minutes, you're going to hear from some very special guests from the White House, our agency, and your peers in the field. Quite frankly, our message is very simple. Thank you. Thank you for your service. Thank you for stepping forward to be part of the solution. You are demonstrating America at its best, people joining together to solve problems. In particular, since the outbreak of COVID-19, AmeriCorps members and AmeriCorps senior volunteers have assisted more than 10 million Americans, providing hope and help at a time of great need, from contact tracing and vaccination support to delivering meals, tutoring students on Zoom, and continuing to make outdoor spaces available and more accessible. You have shown what it means to face challenges and to persevere. At a time of division and isolation in our country, you have brought people together and strengthened our communities. And in no small part because of your incredible service, we, AmeriCorps, have received an historic funding increase through the American Rescue Plan, strengthening the role of service in beating COVID-19, building our economy back, and increasing racial equality. So before we go any further, I want to again say thank you and send out a thunderous applause to every single AmeriCorps member and every single AmeriCorps senior volunteer. Your program leaders, you and your staff should all be extraordinarily proud. We are forever grateful for your service and for all that you have done to improve the lives of so many during this challenging time. And now it's my great pleasure to introduce our first guest, who actually needs no introduction. Even before day one of the Biden-Harris administration, he was in your corner, championing AmeriCorps. Although he could not join us in person today for a virtual celebration, I am delighted to share this video message from the Second Gentleman of the United States, Douglas Emhoff.
Hello, AmeriCorps. It's hard to believe that we've already made it past day 100 of the Biden-Harris administration. I love my new role serving as Second Gentleman. And one of the best things I get to do is connect with people like you, people who are making a difference. AmeriCorps members and AmeriCorps seniors volunteers are a shining example of what is possible when we work together to support our neighbors in need. You are supporting children who have fallen behind in school because of this horrible pandemic. You are providing aid to families struggling with not enough to eat. And you are helping Americans get their COVID-19 vaccines. In the past 100 days, I've had the opportunity to travel across our beautiful country and check in with Americans. I visited hunger relief organizations in Nevada, Iowa, and here in Washington, D.C. They told me about the surge of families in need of support and how the pandemic made hunger in America, a problem that was already bad, even worse. I met with medical professionals, community organizers, and volunteers at vaccination sites. The stories they shared underscored the power of community partnership and the importance of working together to make sure the hardest to reach populations are getting the facts about getting vaccinated. The reality is, every family in every community has felt the impact of this very difficult year. But it's people like you who have helped our communities cope. I know firsthand that your service and the service of hundreds of thousands like you has made a significant impact. You've brought people together. You've provided support, and you're giving people hope. These are the building blocks to help our country recover. AmeriCorps members and AmeriCorps seniors volunteers exemplify everything that is good about this country. Thank you so much for your service and for getting things done for America.
We are so honored to have the White House join us today in this important moment of gratitude for our AmeriCorps members and AmeriCorps seniors volunteers. I'm Karen Dahl, Senior Advisor for COVID-19 at AmeriCorps. I'm so excited to be with all of you. In the last 100 days, I have learned so much about the work you are doing to help communities across the country respond to and recover from the pandemic. I actually got to participate in my first in-person site visit yesterday with AmeriCorps seniors, RSVP volunteers serving with Meals on Wheels in Staten Island here in New York City. They are making sure homebound seniors and other vulnerable community members have food to eat and someone who cares during this especially isolating time. As an AmeriCorps Vista alum, it was inspiring to be out in the field again. I was lucky to present longtime volunteer Ned Rogers with a Presidential Volunteer Service Award. In our conversation, Ned explained something I think many of us feel every day. People think this work we do is altruistic because we're serving others. The truth is, we get a lot out of it ourselves. It gives us purpose, it gives our lives more meaning, and for some of us, it even helps us bound out of bed in the morning, maybe especially during tough times. This past year has been a scary one for all of us, and I'm so very grateful that each of you stepped up to help, even when things were uncertain. I am thrilled to join your ranks during this crucial time for our country and lift up your work for all the world to see. It is now my great honor to introduce the vaccinations coordinator for the White House COVID response team, Dr. Bashara Shukhair. Dr. Shukhair focuses on coordinating the timely, safe, and equitable delivery of COVID-19 vaccinations across the country. Prior to joining the Biden-Harris administration, Dr. Shukhair served as Senior Vice President and Chief Health Officer at Kaiser Permanente. This work included the creation of the nation's largest social health network to meet the housing, food, and transportation needs of its members. He also previously served as the Commissioner of the Chicago Department of Public Health. Dr. Shukhair has been an advocate of our work since long before he entered his role with the Biden-Harris administration, including advocating last year for the inclusion of AmeriCorps in a public health response to the pandemic. From our first meeting, he has been an enthusiastic supporter of your work and has asked for and shared countless stories highlighting the impact you are having across the country. As you know, he and the White House COVID response team have had enormous success in their efforts to get Americans vaccinated, putting equity and efficiency at the forefront with a specific focus on disproportionately impacted communities. Dr. Shukhair will now share a bit more with you and moderate a panel with a few of our AmeriCorps members and AmeriCorps senior volunteers. Dr. Shukhair, we are so very honored to have you with us today. Thank you for taking the time out of your schedule to help us celebrate all of our AmeriCorps members. I'll let you take it from here.
Thank you so much, Karen. And it is so wonderful to be with you all today. I am so thrilled that I get a chance to see the work that you're doing every day. I'm a family physician by training, and I spent most of my career working in community health centers, and I got the opportunity to work with AmeriCorps folks in the clinic for years and years during my tenure in Chicago as a practicing physician, then a medical director of a community health center there. So I know firsthand the value you bring to anywhere you go. So when I got this role to be leading the vaccination efforts in getting this country vaccinated, I was so thrilled to see so much engagement from AmeriCorps members across the country. So I want to start by just providing a few highlights on how far we've come in the last 100 days when it comes to our vaccination efforts, and really start by thanking all of you for all the work that you've done to get us to this point. I want to start by just saying that as of this point, we've administered more than 245 million shots in this country. We have more than 145 million adults who've received at least one dose of the vaccine, and we have 105 million people who are fully vaccinated. If you think about that for a moment, 105 million people fully vaccinated, that means every second since January 20th, we've had 11 people in this country fully vaccinated, 24 hours a day, 7 days a week. What an achievement. And I am totally in awe as to how our country came together, how everybody at so many different levels of government, private sector, not-for-profit sector, faith-based communities, community-based organizations, all coming together to make a difference. And I am so grateful for the work that you've played to get us here. And as I look on the next phase of our vaccination campaign, I think most of you have heard the president yesterday setting a new target for us, and that's getting to 70% of adults with at least one dose of the vaccine by July 4th, and 160 million people in this country fully vaccinated. That means the new goal is going to get to the new goals, we're going to need to do another 100 million shots in the next 60 days. And we all know this is not going to be easy, and it's going to continue to require a lot of hard work. And I continue to look forward to working with you all to getting us to achieve that second goal. That this new goal, the 70% of adults getting to at least one dose by July 4th, is a critical goal for us. Because when we achieve that and when we get closer to that, we're going to see steeper declines in number of new cases, steeper declines in hospitalizations, steeper declines in deaths, and we would have taken a serious step towards returning back to normal as a country. So I want to thank you before the hard work that's coming in this next phase of the campaign. And this is going to be all about making sure that we're making access to the vaccine easier and more convenient, which means a lot more walk-up clinics, no appointments needed. Yesterday, the president asked FEMA to focus more on smaller community vaccination sites, more mobile clinics to meet people where they're at. That also means that we have to continue to work on building vaccine confidence. And that's why we're putting lots of resources out there to support people in having their questions, their legitimate questions about the vaccines answered. And I know you have been and will continue to play a big role in building vaccine confidence in your role. And it also means that we have to continue to focus on equity. Equity has always been at the core of our vaccination strategy, and we're going to continue to focus on equity. That's why we've launched an effort focused on community health centers. We've made sure there are mobile clinics popping up across the country. And yesterday, we've launched a new effort focused on rural America to really double down on the work that we've done all along to support rural communities and access to the vaccine and building confidence to the vaccine. And I have no doubt that you'll continue to play a critical role in this effort. You know, I had the opportunity to visit with AmeriCorps NCCC team leader Megan Naiwis and the Blue 5 team at a community health center vaccination site that supports underserved communities in the California Bay Area. And it was so great to see this group in action. I hear this team now is in Anchorage, Alaska, helping elderly communities repair their homes. So what an amazing transition. So go Blue 5. And I also know that at least one AmeriCorps team was instrumental in helping FEMA develop their mobile site operations best practices, which are now used at thousands of sites across the country. And I think we'll learn a bit more about this in a minute. And I have to say that while my role is focused on vaccinations, I know that AmeriCorps members and AmeriCorps seniors, volunteers are focused on many aspects of the response to the COVID-19 pandemic, including testing, tracing, transportations, companionship, education, food insecurity, and many more. So thank you all for all the work, for stepping up, going above and beyond during one of the scariest times in our nation's history to serve. Your efforts have made a huge impact in our country's ability to respond and to recover from this pandemic. So thank you for everything you do. And now I have the pleasure to be able to speak with a few of you to learn more about a small sample of the work that you are doing. So today we have Parth Singh from AmeriCorps NCCC, a team that served on vaccinations. We have Alfredo Valenzuela, an AmeriCorps state and national member who worked on food insecurity in Texas. We have Emily Borman, a retired public health nurse who served as an AmeriCorps senior volunteer with RSVP in Iowa, and Sierra Bickford, an AmeriCorps Vista member helping with vaccine outreach in New Hampshire. So lots of great group, and I'm really looking forward to having a quick Q&A with them, and I'll start with Parth. So let me start with you, Parth, and you and the AmeriCorps team recently completed serving with a mobile vaccination site in California. Can you tell me and tell the audience a little bit about what your day consisted of?
Yeah, absolutely, sir. So my name is Parth. I've had the privilege to serve alongside AmeriCorps Team Red 1, supporting vaccination of around 300,000 people in Oakland, California. We started the day off at 6:15 a.m. and we would drive to the Oakland Coliseum, which is the main vaccination site. We would usually spend around 30 to 45 minutes doing our COVID screenings, getting breakfast, checking in with our mobile incident command, getting safety briefings, and then we would all travel together to the mobile vaccination site for that day. And then when we get to the mobile site, we would conduct everything from setting up traffic controls, registration, shot delivery areas, observation areas. So really setting up the entire mobile vaccination site. And then throughout the day, my team members would be supporting the different stations. They would be doing registration paperwork, doing traffic control, medical scribing for the paramedics, and then observing folks at the observation area. We also got a chance to resolve any logistical or personnel issues or client issues that we experienced on the day as well. And then we also supported the medical team in keeping count of the patients so they would know when to bring in new vaccinations and new doses. And then around 4 or 5 p.m., we would break everything down and conduct a feedback session with all the leads to ensure that we would be sharing the best practices for the next day and be on the same page.
That is just so wonderful. Thank you, Parth, for sharing this. Alfredo, I know you're volunteering in your hometown of El Paso. Do you want to share with us a little bit more about your experience and what drew you to this work?
Absolutely. So I have been searching for opportunities to serve my community at the onset of the COVID-19 pandemic. Thankfully, I scrolled across an Equal Heart AmeriCorps advertisement on social media. I applied, and before long, I was serving alongside 35 Equal Heart AmeriCorps members at El Pasoans Fighting Hunger Food Bank in El Paso, Texas. A little bit, or some background on the food bank. Compared to the 32.5 million pounds of food distributed in 2019, El Pasoans Fighting Hunger distributed 139.7 million pounds of food from January through December of 2020. That represents a 329% year-over-year increase in the poundage of food distributed. These figures reflect the breadth and scope of the work being done by the El Pasoans Fighting Hunger Food Bank, the only food bank in El Paso County, and the youngest member in the Feeding America network. I'm incredibly grateful for the opportunity to help meet the food insecurity needs in my hometown. So I'm thankful and grateful to AmeriCorps for this opportunity.
Thank you, Alfredo. I think we all know that this pandemic has impacted our communities disproportionately across the country. And clearly, if you are a person who didn't have a stable roof over your head, you are impacted disproportionately. We know that if you didn't have enough food at your dinner table, you are impacted disproportionately. So thank you for all your work to addressing the food insecurity is a huge, huge deal in our response to the pandemic. Emily, as a retired nurse working in Northern Iowa to try to getting people vaccinated, tell me a little bit more about that, and maybe a little more also about the role nurses could play, particularly getting the folks who are still hesitant about the vaccine, who still have questions about the vaccine. So I'd love to hear more about your experience in Northern Iowa.
Okay. Well, thank you for this opportunity. Yes, I live in rural Northern Iowa. We do have a high percentage of elderly people in our county. So because of that, first our local public health agency decided to start out with a call center for people to make appointments, because a lot of our folks don't have internet access or they weren't comfortable with making appointments online. So at the call center, we made appointments for both the first and second appointment. We started filling out the demographic information, and then we also made reminder cards that were given to the people at the actual appointment. people were so excited. They called over and over. The first call center I worked at, it was tier 1, and people for EMS and elderly and teachers. So we had children calling for parents. We had spouses calling for their spouses. One gentleman told me he tried 700 times to get through. Another person said that he tried over 400 times. So it made a huge difference. Then when they also helped at the vaccination clinics, and we had people coming in. It was an in-person clinic, and people were so excited. I talked to a lot of people, and one of the questions we asked was, had they had COVID? And people would say, well, no, because I haven't been anywhere. So they were very excited to be there. We asked people to stay for about 15 minutes afterwards to make sure they didn't have a reaction, and people were visiting with their neighbors, even though they were socially distanced. I think people were visiting with people they never had seen before, just because they were so glad to be out and about. And one of the things that I did when I was actually giving shots was I was answering questions, trying to correct some of the misinformation that people had, and encouraging people to tell their family and friends to get their vaccinations as well. Because at first people were very excited to get their shots, and those people have been vaccinated now. However, like you said, we are running into a lot more vaccine hesitancy, and there's a lot of issues out there for a variety of people and a variety of issues. So it's going to be a challenge, but I think if we keep at it, we can chip away at those numbers and convince them to take a shot.
Great. Thank you so much, Emily. And for the audience, we're going to stay a few more minutes since we got started. We got a late start, so we can get a chance to hear more from our panelists here. I do want to just spend a moment, Sierra, and I know you are interested in a career in public health, and you sought this position with Vista as an opportunity to give you an exposure and more exposure. And I know you've been working on vaccinations, so you want to share with the group a little bit more about your experience.
Yeah, of course. This year, the organization I work with, the Public Health Network, has had the objective to vaccinate populations that would otherwise fall through the cracks of the regular healthcare system. And the main way we've been accomplishing this is by having our operation be entirely mobile. For many of our vaccine recipients, it would be very difficult or impossible for them to get to some of the larger vaccination sites. So we travel to places in their communities like senior centers or low-income housing units or schools, to make getting vaccinated as accessible as possible for these underserved groups. I specifically work in creating more capacity for our organization by recruiting and onboarding and managing the volunteers that will run these clinics. And I get to see our volunteers go through every step of this process, from the first recruitment call to guiding them through our training process to teaching them their station duties at the first clinic. And it's really gratifying, and I've gotten to know some really wonderful people.
That is just so wonderful. And Sierra and everybody on this call, I think this is the core of what we really need to be doing in this next phase of the campaign. It's a lot of the groundwork, a lot of the micro planning, and this type of work is going to be really what's going to get us to achieve the 70% goal. So thank you, Sierra. And while you have the mic here, can you tell me a little bit about how serving as a Vista member, what did you learn? What did you learn about public health through this process, and how is it preparing you for your next step in your career? And obviously, I'm biased here. I am a physician, but I'm really a public health person, so I'm always excited when I see people who are interested in careers in public health. So tell us a little bit more about that.
Yeah, my experience has really taught me how important it is to have the community members we're serving involved in the public health process. In my organization, as often as we can, we involve community leaders in our clinics. These can be teachers or local healthcare professionals. Basically, involving community members lengthens our reach to underserved populations and really just leads us to being able to help more people. And on a different note, my Vista experience has placed me in a leadership role with a substantial amount of responsibility. And because of this, I've really improved my ability to communicate with large groups of people and have become comfortable with delegating tasks in very high pressure situations. And these are skills that I know that would be invaluable in any career I pursue in public health.
Thank you. This is so great to hear. Parth, I want to go back to you for a moment. And now that you've spent so much time on the vaccination front, what advice do you have for me or to our team as we're thinking about this next phase of our vaccination effort?
Absolutely, sir. So before AmeriCorps and CCC gave me a chance to serve as a team leader, AmeriCorps gave me a chance to organize mega distributions at one of the largest food banks in our country. So while these may be unprecedented times, the distribution model and the problems that arise with it aren't new. So based on my team's 7-week deployment, there are 3 operational tactics that we can employ to increase both engagement and shot delivery. So one is increased strategic partnership between mobile vaccination unit command and the community-based organizations that they're serving. So unit command should understand the community that they're going into, plan for its need, and partner with all the community partners in that area. So we actually partnered with the lead paramedic and a retired Green Beret, Akil Bey, who taught us how to build site advance plans and checklists, which helped our unit command get an understanding of the community and the demographics and the CBO's mission, and articulate to them the expectations and the support mechanisms in place for them before they even got a chance to start the mobile vaccination in their community. So this is a short version of the analysis that we at Peace Corps have also done in our deployments, which is called PACA. My second recommendation would be to equip CBOs with distribution best practices and scenario mapping. So they can start off with the immediate high performance and kind of gain that trust with the community that they're there to deliver vaccines in a very professional and effective manner and have contingency plans in place for common problems that could arise. And third is to encourage and empower bottom-up solutions. Having a one-size-fits-all policy throughout this country for distribution is not effective because each community has their own needs, which require targeted solutions. So more often than not, I believe that those solutions come from people that are on the ground instead of rotational leadership. So these are some of the 3 tactical things that my team has delivered. Sarah Mears, Claire Browning, Hannah Brennan, Nick Patterson, Marisol Meja, and Terrence Campbell. So I'm extremely grateful for them to giving me this chance to serve alongside them. So bottom line is these common distribution problems such as low turnout or logistical issues, supply chain concerns are not new. And then if given the chance to be strategic, we could mitigate some of these and get shots into arms.
This is just so wonderful. And as I'm keeping also an eye on the chat, I think Adrienne was referencing how many times she's hearing the words community and partner, and there's so much service wisdom on this panel. So I can't agree with her more. So thank you for that, Parth. And I couldn't take notes of all these great ideas. So if you don't mind sending them to me by email, I would really appreciate it. Alfredo, I want to go back to you for a moment on food security work, and just maybe you can share with the audience how your work has evolved over time when it comes to meeting food security issues for the communities that you're serving.
Of course. So there was a clear recognition among the food bank's leadership team that more needed to be done to ensure equitable and timely access to sustenance as the COVID situation in El Paso quickly deteriorated. So 5 primary food distribution sites and roughly 15 mobile pantry sites were established in strategic locations across the food bank service area. And in May 2020, El Pasoans Fighting Hunger launched an innovative home delivery program to better serve homebound individuals. This includes elderly individuals, people with disabilities, medically frail individuals, COVID-19 positive individuals, and individuals in quarantine. So from May through December of 2020, the COVID-19 home delivery program made over 39,000 no-contact home deliveries and became a model emergency response to COVID-19 for food banks and pantries across the country. As Equal Heart AmeriCorps members, we played an integral role in assembling the thousands of emergency food boxes that were delivered to homebound individuals in the food bank service area.
That is just so wonderful. Thank you. Thank you so much, Alfredo, for everything you've done and you will continue to do on this front. You know, I think I keep looking forward to the day that we're going to be able to put this pandemic behind us and recover. And I really look forward to an equitable recovery, and issues like housing insecurity, food insecurity, problems with transportations, people working full-time and yet not being able to meet their ends meet. All of those are issues that are going to be critical for us to address and think about as we recover from this pandemic. The last question, I'm going to go back to you, Emily, and I know you've done some amazing work by working in Northern Iowa, in rural communities. Any advice you have for me or for our team as we're thinking about how to continue to build on the work in rural America and really make sure that we're making access to the vaccine easier, building vaccine confidence, and making sure we do everything we can to address the needs in rural America?
Well, I think I'll go back and agree with the local partnerships are huge. Many years ago when I worked full-time for public health, we were working on some of the bioterrorism. We talked about pandemic planning, and we started building relationships with our local partners at that time. And it was certainly obvious when I was helping with the clinics how many of those partners were there. We had one site that people could come to. We worked with a paper and radio station. People knew where to go. We had weekly press releases so people knew what the times were, and it was pretty easily accessible for our elder folks. I think now we're going to have to work on a different population, and I think maybe some social media and some one-on-one kind of conversations, because the people that we have vaccinated were the easy ones, and it's going to be some of the ones now that will need a little bit more persuasion to get it. But I think hopefully just seeing that the confidence that people have now that have had both shots, that they're out and about in the community and telling other people how much better they feel, that they don't have to worry about getting sick when they're going out. And now with some of the new guidelines on masks, hopefully that will convince people too that it's the good thing to do. I worked in public health a long time, so obviously I believe in vaccinations, and I've been telling everybody the power of being vaccinated.
I want to thank you all. This is the highlight of my day, to have the opportunity to share the stage with the four of you. Thank you for everything you've done, Sierra, Emily, Alfredo, Parth. It's truly an honor to be with you and spend this 15, 20 minutes with you all. And with that, I'll turn it back to Karen.
Thank you so much, Dr. Shukeri. Really appreciate you spending the time with us and learning a bit more in detail firsthand. So thank you again so much for your time. And thank you again to the panelists, Parth, Alfredo, Emily, and Sierra, for sharing your stories with us and providing us all with some hope and inspiration. I am now going to turn it over one last time for Mal to close us out. Thank you.
Thank you very much, Karen. Appreciate it. And many thanks to all of our speakers today for helping us honor AmeriCorps members and AmeriCorps senior volunteers. You have all challenged us by your actions to do more for each other and to really give a hand up to everyone who needs it right now. We often say that we are in the people business, and I can't imagine a better business to be in. The four members and volunteers we heard from today are incredible ambassadors for national service. We have the best people, all of whom embody hope and light and love. And my thanks to you and everyone who joined for today for what you do. And I wanted to leave you with an exhortation. First of all, if you've already been vaccinated, congratulations and thank you. You're already part of the solution. If you haven't yet, I want to really encourage you to go in that direction. Please do it for yourself, do it for your family, do it for your community, and do it for your country. Thanks again. Have a great rest of the day. Bye-bye.